So my name is Lydia Adira, or Lids or Lydia. I work at Seattle Central College. I am the manager for these two non-clinical healthcare bachelor programs. Bachelor programs at Central are BAS programs, and that stands for a Bachelor of Applied Science, which just means that part of your final project is going to be some hands-on experience or at least research type experience for real life situations. The two programs we're going to talk about today are Community Health and Education and Healthcare Services and Management. If I can get this to, there we go. So we saw the little diagram of what our schools offer, that students have their high school education and then their certificates and then associates and then bachelor degrees. So I've done the same thing here, but a little bit different in a pyramid. So your high school diploma is your base information, your building block. Certificates then come after that. From your certificates, you can build on there. And a lot of medical certificates, you only need about 20 or 30 credits to complete. And then from there, you're ready for those last couple of years. So here at Central, we like to pride ourselves in the way we set up our Bachelors of Applied Science, because we feel like our students get the confidence they need in a professional environment. We also are equity oriented, that we want our students to be able to work with a diverse population of people and be able to implement and evaluate and improve processes in place using both personal input and data-driven ideas. Some bonuses about coming to Central is that if you've been a Central student or even at North or South, all of our transfer things, they build together one on top of the other, and you really can suddenly just have your degree. Another reason that Central is a great place to come is small class sizes. Our class sizes have a maximum of 30 students, and generally there's about 25. We have lots of support. We have tutoring services, libraries, writing support, math and science support also, but we don't have very much math or science in our, well, we have research, but not science classes like biology or chemistry. And then at Central and all of the Seattle colleges, we try to keep our tuition as low as we possibly can. So approximately $7,677 is about the cost to attend for the bachelor program. So going back to our little pyramid here, to get into the bachelor program, you do have to be very close or have an associate's degree. And preferably, you have some kind of history or background in healthcare. So if you have a certificate in medical assisting, pharmacy tech, EMT, dental assisting, any of these ones on the list, then you can go and you can finish up your associate's degree. If you have at least a 2.5 GPA, you're eligible then to be in the bachelor program. So that's that kind of step up. So here are the requirements. So for the community health and education, you have to have a demonstrated interest in healthcare, an associate's degree with at least a 2.5. You need English 101, and you need to at least be eligible for math. For the community health and education program, a demonstrated interest in healthcare just means you've either taken healthcare related classes, you have a certificate, maybe you work in a doctor's office, maybe you've done research projects or humanitarian projects. That would all count as experience or interest in healthcare. For healthcare services management, this one requires at least a year of experience working in healthcare. Everything else is the same, but we need that 1 year of experience in healthcare because this is a management job. So this is for people who are working in the field right now and they're ready for that next promotion they're ready to finish their degree, whatever it is, but you need that year of experience to know what it's like to be a leader in a healthcare environment. So that's why that's important. So an overview of these two programs. For community health and education, I like to think of this as like a public health degree, but because it's an applied bachelor degree, we incorporate service learning hours, which means that whether you're working somewhere right now that you could use, or you could get 15 hours of volunteer hours at a place that interests you, you're getting hands-on experience that you're able to tie to the information. So you're able to go out into these communities, see how programs are evaluated and created and implemented. I think this degree is great for just about anybody, but it's especially great for people who have interests in maybe pursuing a public health master's degree, social work degrees. We have a pre-physician assistant degree for this option as well. And it really is for people who are motivated in problem solving for larger communities. Now, the healthcare services management program, again, it's a little bit more managerial. It's made for people who are working in the offices, that there are accounting classes, there are HR classes, you're learning about how to deal with public relations and how to deal with employees and staffing. So it's just a little bit different in the way that it deals with healthcare issues. Some possible options of jobs that a person could have for these degrees are as such. So for the community health and education, you could become a health educator, project managers, some kind of clinical educator, outreach in communities. And then, as I said before, a lot of people pursue public health, and then there is a physician's assistant pre-track. For healthcare services management, it's a lot of administrative options and clinical programs, practice managers. Both of these degrees make students eligible to take the community health education specialist exam, which would allow you to become a health educator. Now, the CHED track, Community Health and Education, does have that pre-PA track, that pre-physician's assistant track. So what are the differences between the two tracks? Now for the CHED, just the regular track, it's a minimum of 2.5 GPA for the bachelor classes and a 2.0 for any of your other classes. Both of the degrees require you to take English 101, 102, Humanities 105, and 146. And for the pre-PA, you need to get a 2.7 in these classes, along with a requirement of these extra science classes. So these are basic biology, anatomy, physiology 1 and 2, micro, and then a chemistry class. And so those are pretty standard. We pulled these standards off of the MEDEX requirements from UW. So these are the minimum requirements. We encourage students to bolster their transcripts with other classes that they think would help them be more attractive to programs they're interested in. But these are the basic requirements and what you would need if you were planning on pursuing a PA track. So it looks like this. So English 101 is the same, 102, math, the same, and then humanities, there is humanities here. But then rather than a little bit more freedom for your lab science and your natural science, you are required to do these other science classes. So it's a little bit different, a little bit higher GPA, but definitely doable. As far as the classes go for these two, there are 45 credits of what we call core bachelor class curriculum. Now for these two programs, they are sibling programs. So there's two classes that are offered for both programs, and that's these information literacy classes, Allied Health 330 and Allied Health 401. These will teach you all about researching, research presentation, how to find reliable information and medical information that is accurate. I feel like in today's world, it is so hard to know what information is true and what isn't. So this is for that. Now, if someone was feeling really ambitious, they could do a dual degree, which is an option, which means that they would just take these classes once, and then they could take the other classes. And then normally there's, for the Capstone Project, there's, oops, oh no, there we go. So for the Capstone Project in your final year, it's 3 classes in fall, winter, and spring. 1 credit in winter, 1 credit in winter, or 1 credit in fall, 1 credit in winter, 3 credits in spring to make up 5 credits for your final capstone. Your final capstone completely brings together everything you've learned. So you make a final presentation based on all of the things you've learned and what interests you. And you're able to tie key ideas in this project. So if you were to do a dual degree option, you could do 1 capstone project for both of these degrees at the same time, and you would only have to take these classes once. So you would have these 2, 4, 6 extra classes, but that would just be instead of electives. So you could very easily make a dual degree if that interested you. And that is what it would look like. And the big bonus of this is the capstone. Being able to make one, it would be larger than if you just did one or the other, just to cover all of the objectives. But it is nice to be able to tie in a lot of interesting concepts all to the same project. So for the dual degree, the biggest difference is, and I'm going to go back just really quickly, just to show you all of these classes rather than electives. So for a general degree, it's 75 credits. And with a dual degree, you only need 40 credits of electives. You get to take those your information literacy classes only once, and you can complete your capstone project all at once. So again, the capstone project, it's the culmination of all of the learning. This project is really, what I love about this project is that if you have a specific topic of interest, you're able to use that in all of your classes to slowly gather data. And then by the time you get to your final capstone, you already have all of your work collected, your citations, any kind of articles or journals, and then you're able to relay all of everything you've learned in this final project for your peers. So I think it's a very comprehensive program that way, where you're learning and you're thinking and you're all looking ahead to this final project that you're going to do, which I love. I think it's great. So the tuition for these programs, I know a lot of people, this is like, come on, just tell us, this is what we came for. So for tuition, I gave you the initial number of about $7,600, but that would be for an in-state resident. So 1 credit of bachelor level classes is about $234 versus a non-resident, which is about $247. It's not a huge difference, but it does add up. And then the rest of the regular course fees, technology fees. But like I said, Central works very hard to keep their tuition as low as possible. So before I open the floor for questions, these are the main questions we usually get, which are there different pathways you can take? Yes, absolutely. Are we accredited? Yes, absolutely. And can you go to graduate school if you graduate with one of these degrees? And the answer to all of these questions is yes. I'm going to leave these up here. These are what we call the learning outcomes. And so these are our pillars that we lean on when we're shaping any curriculum or tasks that students do in the classes. And I won't read these just because it's so long and I don't think everybody wants to read both of them, but I will leave it up here while I open the floor for questions. Again, these are the program learning outcomes. This is our pillars, our what we really want our students to get out of this program. So I hope that makes sense. I'm going to stop recording now.